The focus of our center is the implementation of the United Nations Sustainable Development Goals in medicine and health education. We will qualify future health professionals to make wise, evidence-based, sustainable decisions.
And in addition to being evidence-based, such decisions must be based on key principles and values that underpin the SDGs, such as applying long-term perspectives and also broad and multi-sectorial approaches to health, ensuring that no one is left behind. And the COVID-19 pandemic has made it impossible for us to ignore the SDGs. And as Ole Petter Ottersen and I argue in this recent comment, the pandemic brings to the fore the consequences of not having health insurance or access to health care, not having water or food supply during lockdowns, or not having civil rights. And therefore, with health as a lens, it is apparent how the myriad targets incorporated into the SDGs are interlinked and interdependent.
Since the 90s, lots of resources have been invested in research and development in order to facilitate sustainable education. But little or none of this has been related to our professions. So drawing on a framework of competencies for sustainable development, which is previously outlined by UNESCO, the aim of our center is to translate and adapt this framework for the use in health professional education. The competencies are system thinking competence, anticipatory, normative, strategic, and collaborative competence. And our basic assumption is that we, by fostering these key competencies, can prepare future health professionals for making sustainable, evidence-based decisions on different levels of healthcare.
And to give one example, what we mean by system thinking competency is to cultivate the students' abilities to analyze complex systems. And in the field of healthcare, this general competency can be translated into a concern with social determinants of health. And the importance of housing conditions during the pandemic is only one example of this. And in SHE, we will try to translate this into pedagogical approaches, such as analysis of complex cases.
Anticipatory competence is the ability to craft rich pictures of the future related to sustainability issues and sustainability problem solving. In healthcare, this means to identify potential conflicts between available treatment, patient lifestyle, or risk of overtreatment. Teaching student risk assessment can be one possible pedagogical approach.
So she will basically develop and test educational modules and pedagogical methods, and also pilot new models for evidence-based decision-making inspired by the SDGs, both nationally and internationally.
Faced with the immense challenges embodied by the SDGs and highlighted by COVID-19, we strongly argue that the biggest threat to the implementation of the SDGs is resignation and indifference. Thanks to DIKU and the 12 international experts for supporting the faculties as a VIEW application. And thanks to all the supportive colleagues across the Faculty of Medicine. And we are privileged indeed to have a large and very enthusiastic and engaged group of students.
Indeed.
Thank you.
Thank you.